Thanks, ladies, for listening to One Simple Step today. We're going to go over the second trimester, some of the highlights of symptoms, changes, and make sure that you subscribe here on the YouTube channel so you don't miss out on future episodes. My name's Heather Marr, and I'm a pelvic floor physical therapist, and I have the joy of interviewing Jaclyn, and we're jumping into the details of second trimester, months 4, 5, and 6, approximately weeks 14 to 27 of your pregnancy. So if you're joining us and you're in your first trimester, check out this video about her first trimester, and we talked about those details then. Today, we're jumping into second trimester and all the fun things that are changing. A lot of women say it's all about energy. So let's jump in and talk about symptoms, doctor's visits, changes, and what to expect in that second trimester. Thanks, Jaclyn, for jumping in here today.
Of course.
So tell me in one word, what would you describe your second trimester? What would you say?
Busy.
How would you describe your first trimester?
Kind of surreal almost. I think that'd be just a good word to describe it.
And how would you say you changed from first trimester to second trimester? What would you describe in general, some changes?
So I think like the mentality changes a little bit too. Like in the first trimester, you're so excited, you might be telling people and things like that. And we told everybody pretty early. And then, when you get to the second trimester, you're like, oh, wow, it's real. Because you hit that ultrasound, that second ultrasound where they're doing the anatomy on the baby. And that's when you can find out the gender and things become a lot more real. And then you realize, wow, there's so much to do and time just starts to go by pretty quickly.
Excellent. And reaching that second trimester can be a victory because I know the concern about miscarriage is very high in the first trimester because 80% of miscarriages occur in the first 12 weeks. So did you feel that victory, that kind of a relief as you hit that second trimester mark?
I did. This is my second pregnancy. So with my first pregnancy, I felt more of that triumph. It's something that lingered a lot. This time, just going through it one other time and having a toddler, I was a little bit more busy and I was like, oh, wow, we hit the mark. But you do feel a sense of relief, for sure, especially around like that 13 week, my nausea started going away and I was like, okay, here we go. And so it was a pretty big triumph.
That's awesome. What about energy levels? A lot of women say fatigue and nausea in first trimester, and then it changes in second trimester. So did you see a difference between your first and second trimesters?
I did actually, and I do not follow the norm in this category at all. I've heard a lot of women, some of my girlfriends, they're so tired, fatigued the first trimester. And my first time around with my son, I was not fatigued at all. And then once second trimester hit, I really felt the fatigue. And I think it was because my body was changing. So it was more of like a physical fatigue. This time around, I had pretty bad nausea the first trimester. I didn't have that fatigue. And then once we hit the second trimester, I found myself going to bed a lot earlier. When I could take a nap, I did. So I don't really follow the norm in that category because I find more of my fatigue hits me in the second trimester. And now, towards the end of my second trimester, I started really getting more energy again. So I don't follow the norm in that category.
And it is true. Every pregnancy is different. Even women that have had 4 and 5 pregnancies, like this one's different than this, or my mom had this. So it's interesting. As we have these discussions, there are some variations, but it's good to just kind of discuss and just see what women are going through. It's great. Yeah. What about the round ligament? Again, the round ligament goes from the uterus down to the labia majora or the mons pubis. So it comes down this direction. And in second trimester is when your uterus starts to grow out of the pelvic cavity. And that's when we start to see the baby bump. Again, that varies from woman to woman. And I know if you're not getting your baby bump early in on your second trimester, it's like, where is it? I want to see it. So just wait, it'll come. So round ligament pain can be that sharp stabbing pain. Sometimes when you sneeze or cough or you stand up and it can grab you, it's short burst. Have you felt some of the round ligament pain yourself?
Yes, I did. So my first pregnancy, I just wanted to say I did not show till I was about 19 weeks. I did not have that baby bump and I wanted one so bad. time around, I had my baby bump very early, and I didn't want it. So anybody who's in there first and they want that baby bump, it'll come. But I did get round ligament pain the first time around, just because I could really feel my uterus like stretching, and it was more of that pain in my lower back. This time around, I haven't felt it as much. I think probably because I've already stretched a little bit, but I do get that that term they call lightning crotch.
Yes.
I've gotten that several times this pregnancy, and I did not last time. And so that was a new feeling, and I was like, whoa, it just felt a lot different. But I've been a lot more conscientious this time around. We've got a treadmill, and so I've been walking a lot, and I think that exercise and just keeping my body loose a little bit has helped a lot, especially with some of those little pains and things that I was feeling the first time around. I'm not getting that as much this time.
That's excellent. And again, a couple tips for round ligament pain is take breaks, which is hard because we're used to just going at life quickly. So slow down. Also, slow your movements down and breathe. And also, even just doing a little bit of a pelvic tilt can release a little bit of that pressure there. And also seeing a pelvic floor physical therapist to do some massage on that area if it's really intense. So remember to discuss with your doctor if you're having some of these symptoms. And also, if the pain continues on, it may not be round ligament pain, and you want to discuss that with your doctor as symptoms come up. How about the first kick? When did you start feeling your baby kick?
I felt this baby kick pretty early. I felt the fluttering pretty early on because I knew what it felt like. So, for people who it's their first pregnancy, I didn't feel my son kick until I would say like a week before my second trimester ultrasound. And he was a big mover. He moved all the time. In our second trimester ultrasound, we were in ultrasound for over an hour because he just would not sit still. And then with this baby, I felt her kicking earlier. I felt the flutters around 15 weeks. I know a lot of people are like, whoa, if you look it up, that's pretty early. So I would say like the first visible kick that I saw and felt was a little bit, I would say close to like 18, 19 weeks. And now she doesn't stop moving either. We were in ultrasound again for this one for over an hour. My children just don't like to sit still, I guess.
That is great. It is fun to feel those kicks. And again, that's another question that women say, when should I start feeling it? And again, you start to feel just a little bit of a sensation. It's like, did I feel something? And again, those are more of the flutters. And then you start to move into real kicks and around that 20 to 25 week mark. After 20 weeks, you hit your halfway mark in your pregnancy. And excellent. This is a time that you can also start to use a stethoscope to hear the baby's heartbeat. Have you tried that?
Yes, so my first pregnancy, we bought a little like heart monitor kind of thing. And they don't even sell it anymore. But we did, and I would listen to the heartbeat like every night. And so with this one, I listened to the heartbeat, just kind of when I'm curious or things like that. But it's really fun to hear the baby's heartbeat. And I was very surprised when I waited until after the doctor was able to locate the heartbeat. That way I knew like, okay, I should look in this area when I'm trying to do it by myself. And it took my doctor a long time to find my son's heartbeat. And you're laying there and just wondering, where is it and stuff. And, as they grow, then you know the exact spot and you can just put it right on there. But it's fun to listen to the heartbeat.
Excellent. And by month 6, the baby can hear you talk and sing. I know my husband would play guitar and sing to my baby. And actually, my son, when he would cry after he was born and he used that same song, it really calmed him down. So are you finding yourself talking to the baby and singing and that type of thing?
Yes. Well, and I have a nice advantage. I'm a kindergarten teacher. So when I was pregnant with my son, we were always reading books and singing songs and doing all that. And that really helped. And with this one too, I'm still teaching kindergarten. And so she's hearing all of that. And it's funny when we try and have my son, play around my belly or things like that. And we read books with him, she starts kicking. And whenever he's trying to sit on my lap, she starts kicking. So it's really precious. But Yeah, we do all of that. And there were a couple of songs that, this is really silly, but my first pregnancy, I was obsessed with The Office. And I watched The Office, and the baby Oliver would kick every time he'd hear the theme song. And then when he was born and we would listen to it and he would start crying, we'd play the Office theme song and he would stop crying. So I guess it's true. They hear it.
There are some fun correlations between
Yeah.
pregnancy and after delivery. I love it. Let's see, after 20 weeks, then there is some research that shows that as the uterus grows, it starts to press on the inferior vena cava, which is a blood vessel. And so there's some discussions. It varies from doctor to doctor. So this is a good reason to talk with your doctor about it too. But laying flat on your back could result in the uterus pushing down on that inferior vena cava and decreasing blood flow to you, mom, as well as decreasing oxygen to the baby. So the suggestion is to limit that sleeping on the back and laying flat on your back for a long period of time. The suggestion is to elevate about 30 degrees with propping up with pillows. Also, if you're in having ultrasound and you're laying flat, if you start to get dizziness or some change in symptoms, you always want to communicate those concerns. At the flip side, I know a lot of women are like, oh my goodness, I woke up and I'm on my back. Again, doing the best that you can. And that's one of the benefits of sleep, being pregnant, is you're waking up multiple times. So just do your best and prop with pillows and roll back onto your side. So again, that becomes a popular discussion as to what's the best side, and sleeping on your side is best. And left is a little bit better than the right. But again, don't think that the right is harmful. The left is better because it takes pressure off of the kidneys and it helps decrease some of that swelling as well. So again, having that conversation with your doctor. And if you're laying on your back for a short period of time, that's okay. Just pay attention to your symptoms. But what has been your advice and your experience on sleeping on your back, positions, pregnancy pillows? What have you found in your pregnancies?
So I did hear about that too. So my first pregnancy, when I heard that right away to not sleep on your back because of that, I went and bought a pregnancy pillow. And so I have a U-shaped pillow I use, and it is absolutely wonderful. It really helps me sleep on my side because I did, even now, I want to naturally just go on my back. And the pillow has really helped me so that I do sleep on my sides. And the way that I'm able to position it, I can take part of it and put it in between my legs, which provides a lot of comfort for my hips. And I'm able to take the other portion of it and kind of like put it alongside my spine. So that way, if I do want to roll to my back, I found myself, waking up where I'm not fully on my back, but I am tilted a little bit.
Yes.
So it prevents me laying flat on my back for really long periods of time. And I absolutely love it. And now I'm at the point where I am propping up pillows underneath my feet, just because my feet do swell pretty badly. And with my first pregnancy, I did prefer to sleep on my right side because my son was sitting more on my left side of my stomach. And with this pregnancy, I'm wanting to lay more on my left side. But it is nice though, when you do have to wake up like every couple of hours, if you're hydrating or sometimes you just can't sleep. It's nice to wake up often because then I can change my position if I need to. And going into like the end of my second trimester, I noticed that I was flipping about every hour. Just naturally, I'd flip over just because my hips do get a little bit sore when I'm sleeping. And I've used other pillows too and just kind of found what works for me. But that body pillow that I bought, it's a U-shaped one. It's helped me a lot. So.
And a lot of women have found that beneficial too. And another thing to think about is when you're laying on your side, again, if you don't use a pillow between your knees, then that leg drops down and that can cause pressure here on the pubic symphysis, as well as the SI joint on the back as well. So as you're thinking about all these pillows, propping up 2 pillows from your knees all the way to your ankles can align it so that it's like you're standing up, but you're on your side and you still have that space. So sometimes women forget to get the pillow all the way down to the ankles. So that's another thing to think about, to see if you need 1 or 2. And sometimes you use a pregnancy pillow and then add another pillow too. So Comfort while you're sleeping is important in pregnancy, and it's a little bit challenging, but pillows, pillows, pillows. How about your belly? Has your belly itched as it's stretched?
Yes, it has. It did more so my first pregnancy, just because I was stretching a lot. I think I'm a little bit more loose this time. But I found this time around, because I'm working from home, I'm wearing a lot more leggings and I'm wearing a lot more maternity clothes that go underneath my belly rather than over my belly. And that's helped a lot with the itching. I haven't I haven't felt that a lot this pregnancy. And I think a lot of it has to do with some of the clothes you wear. I know, like when we go out to like my parents or something and I put my jeans on, I am a lot more itchy. So my first time around, I was actually like going into the school to work. And so a lot of those materials were very itchy. And so like throughout the day, whenever I had a break, I'd just go into the bathroom and I'd put lotion on there, or just kind of found some things that work for me. Coconut oil really helped me too, but it kind of leaves a little like an aftermark on your clothing and things like that. But yeah, I felt that a lot my first pregnancy.
What about stretch marks? Is there anything that you've used to prevent stretch marks?
Yeah, so my skin, I knew I was going to get stretch marks just kind of based on, like family and things like that. And so I didn't really notice any visible stretch marks my first time around until about 8 months. So once I hit 8 months, I was like, I woke up and I was like, wow, I do have a lot of stretch marks. I got them a lot like on my hips. I did get them a lot. I did get them on my belly, but those went away after time. And so what I like to do is I just do like coconut oil. That really works for me. And then I didn't buy anything super expensive. I know there's all these stretch mark creams and stuff, but I just don't know if it really helped me or not. I guess if I used it and they became worse, or if I didn't use it and they were worse, it did help. But I just use like the Burt's Bees Mama butter
Uh-huh.
I have, and that helped me a lot. And I used it, I was a lot more diligent using it after I had my son, just because, if I was going to lose weight rapidly, which I didn't, I feel like the stretch marks could have been worse. So, I mean, I do have stretch marks
Mhm.
from my first pregnancy. So I anticipate I'll probably get a few more after this one. But I'm hoping that what I'm doing is helping a little bit.
Excellent. Yes. And again, seeing those as love marks as well. Again, the things we do for our children, it is a sacrifice of love, and it's pretty amazing. So, this is an incredible journey. Constipation is very common, and we really want to. I would know it's like, oh my goodness, stretch marks, it's constipation, all these things are negative, but there can be a positive way to think about this. With constipation, the motility and the digestion slows down so that the body can absorb more nutrition for the baby. So there is a benefit and a cause and a reason behind it. But we need to address constipation, because if we avoid it, and it can lead to hemorrhoids, pelvic organ prolapse, where we're really bearing down. So thinking about things like drinking a cup of hot water in the morning, a squatty potty, and then also talking with your doctor is really important if you're dealing with this constipation, because you don't want to take any meds, even over the counter, for constipation. You really want to talk with your doctor to get something that is safe in pregnancy. So what have been your experiences with constipation?
So I didn't get the constipation as much with my first pregnancy. I was very diligent about drinking a lot of water my first pregnancy, and with my doctor's permission, I was taking Miralax too, which helped me a lot. So I didn't really find that. I did get really bad hemorrhoids though with my first pregnancy. With this pregnancy, I started off taking the Miralax with my doctor's permission, and just found that that was just not working for me at all this time around. And I had some pretty severe constipation in the second trimester. And so the Miralax was just not working for me. And so after my first spell of constipation this time around, I really buckled down and I started hydrating a lot more. I've been drinking like decaf green tea, 1 cup a day, and that really helps. But I also included a lot more fiber into my diet. But I knew that I had to hydrate because I was taking in a lot more fiber. So I would eat like oatmeal every other day. If I wanted a snack, I've been trying to snack on apples. And since that episode, I haven't had any. So I've just really tried to kind of figure out what works for me. And that's helped a lot. And I have not had, I did get hemorrhoids after that first like bout of constipation this time around. I haven't had any since. And so I've just been really trying to keep a cleaner diet. And that's helped me a lot this time around.
Truly, it does. And the water consumption is so, so important, and the fiber consumption. So again, 25 to 35 grams of fiber a day is recommended. And keep track of it, because if we don't keep track of it and we're not intentional, we can just, especially in a fast food American diet, our fiber can decrease really quickly. So things like blueberries, steamed spinach, even avocados are a great source of fiber. And so just looking up fiber content, and that way you can pick out the foods you like and really incorporating that. So I think definitely you've made some intentional steps to be proactive about that. Mm-hmm. And also, ladies, how we poop is connected to our vaginal deliveries. So there's a lot of correlations there, because when we poop and when we have vaginal delivery, we want to lengthen this pelvic floor. And a lot of times we push and we tighten and close off the glottis here, bear down, and that sets us up for more hemorrhoids. So as we're pooping, it's trying to blow out, and we can practice pooping for the delivery too. That's a preparation. So we're working on that and really trying to connect with this pelvic floor. Can I feel it lengthen? And that's helpful. Again, a lot of women, or even you'll read things, oh yeah, poop is like a delivery, but we can poop in the wrong fashion. And I bore down that first push as I was delivering my baby. And that's why I got some hemorrhoids too. So it's how you're pushing out, really visually thinking, lengthen that pelvic floor. So that may be some tips as well about how to connect with your pelvic floor and practice now with pooping. Let's move on to back pain. As we progress, of course, with second trimester, the uterus is getting bigger and it grows up to 500 times its size. So it's really big. So it starts to pull, and you've got laxity of joints as well. So a lot of times you'll go into that pregnant posture, which is more of a tilt, or you might find yourself in more of a slumped position, one way or the other. And that can start to contribute to some back pain. So posture is important as we're getting into that second trimester and there's changes. Third trimester, it's harder to change because the baby's so big. So being aware of your posture is important. What have you done? You mentioned that you're exercising and you're moving more. So how have you managed the back pain, or have you had any back pain through this second trimester?
I noticed that when I was super busy and I kind of overdid it a couple of days, my back pain was a lot more intense at night. And I just get lower back pain. But I've noticed that my life is a lot different now. I'm not as active because I'm working from home. And so really making sure that I've got really good support when I'm sitting in my chair has helped a lot. I've used like pillows and things like that, but then getting up and moving like every 30 minutes, like when I'm in a full on day of work, I have a timer and I get up and I just walk around real quick. And that's helped me a lot. But I noticed, like, there were a couple of days, even this second trimester, I had a ton of energy and I was like, I've got energy today. I'm going to do all this stuff. And I did overdo it. And my back was pretty sore. So I think just balancing it for what feels good for you. And for me, my back gets tight. And so just even by walking, that helps alleviate a lot of back pain. And then, really avoiding picking up things that are off the ground. Or I've noticed, like, when I'm squatting, my legs are going out a little bit wider to accommodate for my stomach, but just trying really hard to like keep my back in a good posture if I do have to squat to grab something or things like that, or just being intentional about my movements and not doing jerky movements has really helped, because I did have pretty bad back pain my first pregnancy. In my first pregnancy, I was not proud of it, but I gained a lot more weight. And I think that had a lot to do with it. This time around, I'm doing better. I'm not doing like, great or anything, but I'm doing much better. And I've noticed the back pain is not as like prevalent this time because I think of the weight gain too.
That's incredible. And again, ladies, remember that our core is our pelvic floor, our abdominals, our back muscles, and our diaphragm. It's like a box. So as we're talking about movements and posture, remember still using your pelvic floor and your lower abdominals, kind of like you're zipping up your pants and you're using those muscles. It's okay to use those muscles. It's not okay to do sit-ups during pregnancy, but it's okay to engage those muscles. And again, it's training yourself. And before I stand up, inhale, exhale, zip up to give yourself, so it's not just your back that's trying to lift you, it's your pelvic floor and abdominals too. So those are a couple of tips to remember. And again, through that second trimester to even make you stronger for your third trimester. And let's move on to shoes. Shoes are so important, and we deal with swelling. So, and especially if it's in the summertime, it's like, I'm just going to slip my flip-flops on. And then a lot of women you hear, oh, I gained a size in my shoe size. And that's because of our joint laxity here. It also affects our feet. So that is our base. And some women have said, oh my goodness, I was neglecting my feet. And once I got back into tennis shoes, it made a difference for how I felt everywhere. So how about you? Have you found that shoes make a big difference?
I do. So my first pregnancy, I had a summer baby. So I was that person that was like, I'm just going to throw on flip-flops because it's easy for me. I don't have to bend down. And I did notice like a huge change. My feet were swelling and they hurt a lot. And so then I went out and I bought some shoes that I felt like were pretty good. And this time around, I've been wearing my tennis shoes. And honestly, at the end of my last pregnancy, I didn't even care what my outfit looked like. I was wearing those shoes because that was what worked for me. And they did not match my outfit. And I was wearing a nice, like, work outfit with tennis shoes. And so it really does help. And with this baby, it's been kind of like a winter baby. And I've noticed that some of my snow boots do not have good support at all. And my feet are really sensitive. Like my feet swell. I get the feet cramping. That's what both these pregnancies, I get it so bad. And so just trying to like doing some stretching with my feet, like even going up on my toes, and just trying to do different movements with my feet help a lot. And then I have to elevate my feet when I'm at the desk a lot. So I've got like little stuff underneath the desk where I've just got my feet propped up, but shoes made a huge difference for me.
Definitely. And leg cramps and swelling happen too. So again, like you were saying, before you go to bed at night, stretching the toes up towards your nose. And if you get a Charlie horse in the back of your calf, instead of just hopping out of bed, try to just stretch a little bit slowly, or you can even take a belt and bring it around your the bottom of your foot or the ball of your foot and pull. Those are some stretches that can help. Also eating a banana before you go to bed. And then also with the swelling that happens, because ladies, we have about 30 extra cups of fluid in our body during pregnancy. So that's why there's some swelling that goes on. So when you're aware of the swelling, compression hose can support stockings or compression hose can be great. Talk with your doctor because there's knee highs, thigh highs, tights. And I know that I wore those during my pregnancy as well. What about you? Have you tried any of those as well?
I haven't tried those. I didn't really get any of the calf or the leg. Mine were just really feet.
Uh-huh.
And so I didn't try those, but I felt like, it probably could have been beneficial for me, like my very first pregnancy, because looking back on it, I was waking up 2 to 3 times a night trying to I would get those intense Charlie horses like in my feet. And I'd wake my husband up and be like, I need you to help me stretch now. So I'm hoping this time around that that's not going to happen. But if it does, it would be something that I think I should probably consider trying.
Definitely. Were there any special birthing classes or classes that prepared you for delivery or taking care of baby that you took in second or third trimester?
Yeah, so in the third trimester, my husband and I took all the classes together. So we did a birthing class, and that was really fun just to kind of learn what to expect during, the birthing process, but then also different options that we could have, like while I was in labor. And all of the classes that we took were through the hospital that I was going to be delivering at, which was really nice. So it was kind of following like their philosophy and things like that. And then we also took like a new parent class where you learn how to change the diaper and swaddle the baby. And that was one of our favorites. That was the most helpful for us, I think, just as a couple, because then you didn't have those worries when the baby came of like, how do I do this? And it was a good bonding experience for my husband and I too. And then I also we took an infant CPR class. It wasn't a certification or anything, but it was really comforting to take that class just so in case if we ever needed to use it, we could. So that was another class that we, looking back on, are really glad that we took. And then the last class that I took was a class about breastfeeding. And I think for some people that can be really, really helpful. For our situation, it was a little bit different. And so, if you have to kind of pick and choose which classes to take, the ones that were most beneficial for me were the new parent class and then the birthing class.
That's great. And again, right now during COVID, a lot of those are offered online. You might have to do a little bit more searching to find them, but I have heard of women still taking these birthing classes. So don't feel like it's not an option for you now that everything is virtual. Evidencebasedbirth.com does offer some birthing classes as well. But again, talking with your doctor, seeing if your hospital offers them virtually is another option as well. Let's transition now to doctor visits in second trimester. There are some exciting ones. There's some special tests. So what were some special tests that you had in the second trimester?
So looking back on the second trimester, the big one that I remember was the second trimester ultrasound, and that's where they did the anatomy on the baby. And I love that one. It's so much fun. And we decided to find out the gender then. I know some people choose to find out the gender via blood test, but we decided to wait just until the ultrasound. And so that's so much fun because you get to see the spine, you really get to see the heart, and then you get to find out the gender. So I absolutely love that appointment. That's one of my favorite appointments. It's also one of those appointments where you're really nervous to go to because you're pretty anxious and things like that. And then I also did the glucose test towards the end of my second trimester. And despite what people say, the glucose test is not that bad. Like everybody's like, oh, the drink's gross. I didn't find it to be super gross. It's pretty sugary. Like I did get heartburn afterwards. Those are really the only ones that really stuck out to me. I didn't have to have anything else other than my checkups. And then towards the end of my second trimester, my doctor was preparing me for the third trimester where I'm going to start to go in every 2 weeks for my appointments. And for my appointments, I guess they're pretty quick. I would leave like a urine sample at the beginning. My doctor would just kind of see how I was feeling. I'd bring up any questions or concerns I had. And then now we're at the point where she was like towards the end of the second trimester, she was measuring my stomach and we got to hear the heartbeat and things like that. So those are the main ones that I remember for the second trimester.
Excellent. And again, gestational diabetes test is usually around 26, 28 weeks. And again, it could vary from doctor to doctor. And women tend to be apprehensive about that. But again, seeing it in the light that if you are diagnosed with it, you know what to do, you know about it, and you can be healthier and help baby be healthier as well. And even connecting with a prenatal nutritionist, because it can be overwhelming. Oh my goodness, I have to get rid of all these foods. But things like eliminating your sugar drinks and just choosing healthier food options can be really helpful, as well as doing some exercise, but get some guidance through that. And again, the anatomy scan typically is around 20 weeks. And again, exciting for that gender reveal. And that might be 2D, 3D, or 4D, depending on where you're at. What about the line down your belly, which is called the Linea Alba? In 75% of women, this line darkens throughout pregnancy. Has that changed for you? Have you noticed that?
Yes, I have. I've actually started to notice it like right at the end of my second trimester, I started to notice it. With my first, I didn't notice it until I was well into my third trimester, but I'm noticing it a little bit earlier. It's really faint this time, but I think it's because I was looking for it. But I did have that line for the last pregnancy, and I know I'll have it for this one too.
Excellent. And again, these are just fun things to talk about. Again, second trimester and all the beautiful changes as you've hit your halfway mark. You're looking more towards delivery, looking forward towards your third trimester and delivery. Were there any topics that you began discussing with your doctor, or maybe that you're focusing on, or you're doing research?
So, like heading into the third trimester this time, I knew that once I hit about 7 months is when I really needed to start watching my diet, because my first time around, that's when I lost it. So this time I really, I'm wanting to work with my doctor about like, okay, the weight gain, like I need you to tell me, like, do I need to back off of things? And so that's a big concern for me, just because I know how my body will bounce back after the pregnancy. It took me longer to lose my baby weight, so I want to lose, I don't want to gain as much this time. And then really I'm more relaxed when it comes to like the delivery and stuff, but I know around this time, like some of my girlfriends had been, kind of creating like a birthing plan or thinking about those kinds of things. I didn't, my birthing plan was to do what was best for the baby in that moment. And so really I'm not looking or thinking about too much going into the third trimester other than, really containing, like my diet and like just trying to watch that stuff, and then just, preparing for the baby and doing those fun things too.
Excellent. This is fun. And ladies, there are some resources that I have provided for you. I have a birth prep guide. As you go towards delivery, the fear can decrease if we increase our confidence and our knowledge and expectations. So if you go to the link below, there's a birth prep guide. You can go through all the different things that could possibly happen on delivery day and just your comfort level. And then do you have questions that you need to discuss with your doctor, your birth partner, research yourself so that you become more prepared and you know what you want, but keeping that focus of healthy mom and baby is important too. And as you're in second trimester, looking towards third trimester, again, I've written this book, Connecting with Your Body Throughout Pregnancy. Ladies, I want you to be able to learn your parts, listen to your body, and love your delivery. And again, the more that we know, the better off we're going to be going into the delivery confidently. I've talked about how breathing is important, and this doesn't replace a birthing class, but it's real helpful. And there's places to journal too, so you can remember your highlights from your first and second and third trimesters as well. Thanks for taking the time to share your experiences with us, Jaclyn. And thank you, ladies, for listening. And be sure to subscribe here at the YouTube channel so you don't miss out in future episodes. Drop your comments below. How has your second trimester been? That's going to be helpful too. And if you have other questions as well. Again, thanks for listening to One Simple Step today. And I hope you have a great day.